Hi, Dr. Gary Sanchez here, and I want to talk to you today about new patients. New patients are the lifeblood of every successful dental practice. We all know this. We all know we need more new patients, right? But what type of new patient do you need? I mean, who is it that you're trying to attract? This really goes back to your vision. And I know what you're thinking. You're saying, oh my gosh, I don't want to talk about vision and mission statement and all that kind of stuff. I just want to do my dentistry. And I used to think the same way. And for years, I didn't have a vision either. And we would just, whoever came in the door, that's who we saw. Whatever they needed, that's what we did. And that wasn't a very efficient way to practice. I learned that later. So why do you need a vision? And what is a vision? Okay, a vision basically is just a decision about what it is you want. It's a decision about what type of practice you want, what it's going to look like, what it's going to feel like, who you're going to have there, what kind of equipment. It's a crystal clear story about what it is that you want. Now, why is this important to have? Why do we need a vision? Well, there's a thing called the reticular activating system. It's a part of your brain that filters out everything you tell it is important. And let me give you an example of how the reticular activating system works. Let's say you were looking for a parking space. You're driving through a parking area and you are looking for a parking space. You would notice the puff of smoke coming out of a tailpipe. You would notice some taillights coming on, or you would notice people walking over to their car because you're looking for a parking space, right? But if you weren't looking for a parking space, you would drive right through there and you would never see any of that, even though it was there. So you've told your reticular activating system that you are looking for a parking space, so it goes to work for you finding that parking space. Well, the same thing happens when you create your vision. So if you create your vision with your team and you're all crystal clear on what it is that you want, your reticular activating system will go to work for you 24 hours a day, 7 days a week, to find those things that will create your vision. So that's why you need to know what you want. And that will help you to determine the right new patient. So once you know your vision, then you can say, okay, if this is what I want to create, then these are the new patients that I have to create that vision. And all of this will start to happen automatically once you've decided on your vision. So have a crystal clear vision before you decide what type of a new patient you want. And then it will all fall into line and you'll have the practice that you were dreaming of.